Chapter 5, we're going to talk about special collections. Special collections address a variety of different patient needs and conditions. The first one we're going to talk about is peripheral blood smears. A blood smear is going to be a thin film of blood that we spread onto a microscopic glass slide, and then we can look at those under a microscope. We use venous blood or capillary blood. We use the wedge method. So we're going to touch two slides at an angle, which is going to form a wedge shape. We make sure that that frosted side of the microscopic slide is facing up when using slides that have a frosted end. Frosted end is going to be what we use to write on. Most of the drop of blood should spread out onto that glass slide. Depending on the facility that you work for, it's possible that you may prepare those blood smears yourself or assist a laboratory personnel in preparing them. If the smear is needed to confirm abnormal findings, it must be prepared within 1 hour of collection when that specimen is obtained in that EDTA tube. Blood cultures are used to test for bacteria or other microorganisms in a blood sample. The provider would order this test just to help diagnose conditions in patients who have a fever of unknown origin or unknown cause. The aerobic blood culture bottle, that's a type of blood culture bottle used to collect specimens to test for microbes that thrive in air, so thrive in oxygen. The anaerobic blood culture bottle is a type of blood culture used to collect specimens to test for microbes that thrive in an airless environment, so that oxygen-free environment. In the United States, newborns are screened for various metabolic and genetic defects by analyzing a blood sample that's collected on specific filter paper. This is going to assist in early detection of genetic, metabolic, and infectious diseases and disorders. The blood spot testing is going to be performed before the newborn is 72 hours old. This is state required. Newborn screenings are almost always performed as a capillary puncture on the infant's heel. To perform that heel stick on an infant, you have to follow a certain set of procedures. There's a certain area shown in your book where we would want to use that lancet. So up by the toes, that part, we would not want to do that. Kind of the same thing as when we do a blood sugar on an adult, where we use the finger. We're using the sides of the fingers, not the pad of the finger or anywhere farther down on that finger. Blood donations are another type of special collection that a phlebotomist could perform, working in a blood donation bank, and so on. Collected for submission to blood banks, used as needed by hospitals and other facilities. So the blood that they collect for the blood bank is going to be used when there's trauma patients who are losing blood and they need transfusions, people after surgeries and whatnot. An autologous transfusion, patients are going to donate their own blood to use for a transfusion or upcoming surgery. So with this, if the person's healthy and they know they're getting ready to have surgery, they can go in prior to that surgery and donate their own blood. And then in that procedure that they have, if for some reason they lose an amount of blood and they need that transfusion, they're actually getting their own blood transfused back in. Collecting donor blood, so anybody can go into those centers and donate blood. You can donate with Red Cross and whatnot as well. Those can be processed into various products. So we can be processed for just the red blood cells, just the white blood cells, plasma, and platelets. They do testing on the blood from those donors just to make sure that there's no communicable diseases in their blood, so we're not passing things on. So there is a set of rules and things that they follow when collecting donor blood. Apheresis techniques, that allows removal of one or more products during collection via special equipment. So with apheresis, so we're actually removing the blood plasma from the patient's body without actually withdrawing the blood itself. So this process separates the blood into plasma and cells, and then it returns the cells to the patient's body. We also call that power red. The plasmapheresis is removal of blood plasma from whole blood. So we're removing blood plasma from that whole blood sample. There are certain requirements that you have to meet to be able to donate blood. So some of the general ones, you have to be at least 17 years old, 16-year-olds in some states with parental consent. You must weigh at least 118 pounds. And then your donation has to be 56 days apart. When apheresis will be performed, there's a little bit of a change. So with males age 17 or older, must weigh 130 pounds or more and be 61 inches tall or greater. Females 17 years old, weighing 150 pounds or greater, and a height of 65 inches or greater. Donors must be healthy and feeling well to be able to donate. If they're not feeling well, then they will not allow them to donate. A medical history must be provided. So any travel outside of the country, sexual activity, use of different medications, all of that is looked at. Vitals are taken. A hemoglobin or a hematocrit level is checked. It must be within a certain range for them to donate. Out of range donors will not be able to donate. So again, with autologous blood donations, autologous refers to self. Many donate for their own future use. It's become popular due to the increased concern of the transmission of bloodborne pathogens. People feel a lot better if they know that if they need that blood, they're getting their own. A lot of the times they're going to donate again before having surgery. There has to be a written order by their physician. They must be in good health so the donation doesn't stress their body right before surgery. Their hemoglobin has to be at least 11, and surgical procedure must be scheduled for more than 72 hours after that donation. If not used, it can be transferred back into them. So there are some volume requirement calculations. Iatrogenic anemia is something that we have to look at. It's caused by blood loss due to repeated venipuncture in a short period of time. So we see that in patients who have to get their blood drawn very frequently. It could be cancer patients, it could be patients that have really bad infections, so we have to constantly look at those numbers. So we can actually cause anemia in those patients. People who are most susceptible would be older adults, the pediatric patients, and patients also that are underweight. Older patients are at a higher risk, so due to medications that can suppress bone marrow production, which also then increases that anemia. Blood specimen collection should be limited to 1% to 5% of the total blood volume within that 24-hour period, and then 10% of total blood volume over an 8-week period for pediatric or critically ill patients. So as a phlebotomist, we will deal with non-blood specimen collections. One of the most common performed diagnostic tests involve urine specimens. Urine specimens are going to be low cost, low risk. They can provide a lot of valuable information. We can see glucose levels, hormone levels, signs of infection. So there are a variety of different tests that we can do. We can do a routine urine, a 24-hour collection, a culture and sensitivity. We can do drug testing. And then again, there's various different methods for those tests. So a random, a first morning urine, a fasting urine, clean catch, a catheter, or a suprapubic. Proper collection is key, as with any type of specimen we're collecting. The random collection or the routine, it's the most common performed. There isn't any preparation or time restrictions. Common instructions are going to be used for all urine specimen collections. So we need to make sure we're washing our hands before and after handling the specimen, wear our gloves at all times, change our gloves between specimens. Confirm patient identity. Again, that is so important. You need to make sure that you're collecting the specimen for the right patient. So confirming by checking that name band, checking your order, and having the patient state their full name and date of birth. We need to always use a sterile specimen container. So if the label is messed with, it looks like it's been opened, those types of things, we would need to discard that and get a new one. Label all the specimens on the side of the container, not the lid. Label the specimen in front of the patient. Again, very important. We don't want to accidentally label the specimen with the wrong patient's name. And then promptly test or transport those specimens. Dispose of the urine per your facility's guidelines. You always want to make sure that you explain to your patient what you're going to be doing, or how they need to collect that specimen. It's always very important.